Well, hello, everybody. Welcome to the Institute of Health and Social Care Management and our Scotland conference. Here we are, 23rd of June 2022. This is the fourth, I think, Scottish event that we've held since the pandemic started. And we're absolutely thrilled to be able to dedicate some time this afternoon to our Scottish members and indeed to the challenges facing the Scottish health and social care systems. Just a couple of minor points to start with. We are recording throughout these sessions. Most of you have clicked on I agree in order to join the session now through the videoing paywall. If you on reflection would not like to be videoed after all, could you just let us know and we'll do what we can about that. But better still, perhaps turn off your camera and your audio, and that way we can preserve some anonymity. If you wanted to change your name as well, that would be very, very helpful. We absolutely do understand that some people, depending on what their particular preferences are, would prefer not to be, and we absolutely respect that. So if you could just do that or let us know in the chat, and we'll do what we can to make life as comfortable as we can for you this afternoon. Okay. The second thing I wanted to do was just draw attention to the fact that we don't currently have a country hub for Scotland. We've got one for Wales. Health Education and Improvement Wales is our country hub for Wales. We are looking for a regional hub, effectively, one of the Scottish health or social care regions, to possibly join us as our regional hub, along with multiple other regions of England where we've got similar arrangements. If you would like to be considered, if you think your organisation might like to be a regional hub, even if you're not in a decision-making capacity, do let me know, and we will follow up directly with the powers that be in your particular region, and we'll look to see if we can cultivate some kind of a membership arrangement for you. I just wanted to throw that in there because it would be remiss of me not to. I do hope you'll forgive me. All right, let's get into the nuts and bolts of this. Scotland is a devolved nation. We are very anxious to learn throughout this conference this afternoon of your own worked experiences. What are you facing in terms of your independent challenges? What are you enjoying in terms of the successes that you're able to cultivate up in Scotland? Please, therefore, be prepared to interact with us and feedback, ask questions and so on. That is absolutely the best way for us to find out what's going on and to help you network with members across Scotland who may be facing similar challenges to yourself. I was reading my newspaper the other day. It's quite clear that Scotland is putting up with exactly the same kind of issues as are prevalent across the rest of the United Kingdom and indeed across much of the rest of the world, driven by an increasing demand for higher wages on the back of inflationary pressures, but also, of course, you're dealing with wait lists and how you might manage that. You're dealing with a primary care crisis where you have GPs and indeed practice managers looking for how they're going to, whether they're going to stay or whether they're going to leave the profession. And you're dealing with a crisis in workforce across certainly social care, but also, I suspect, in the healthcare sector. And no doubt we will hear more of that as we go through the afternoon and as people present and share their own experiences of what's taking place. It's quite clear to me, sitting here, I live in South Wales near Cardiff, it's quite clear for me sitting here in Wales that as far as the Welsh NHS is concerned, workforce is the single biggest issue that it is wrestling with. I would suspect that is exactly the same case for Scotland, but if you'd like to comment upon that, do please put something in the chat or unmute, and we would love to hear from you. I can see that our first guest, Jonathan Cameron, has arrived. Hello, Jonathan. Are you here? Are you present?
I hope I am, John. Yeah, I hope you can hear me okay. I've had a last-minute technical hitch, so I've had to switch laptops at great speed, so I'm hoping this is coming through okay, though.
It's coming through absolutely perfectly.
Great.
And I thought what we might do, just to kind of see if we can get ahead of ourselves a little bit, and also give some opportunity for you to enjoy a Q&A with our audience. whether you might like to crack on, because for those of you that don't know, Jonathan is the Director for Digital Health and Care with the Scottish Government. He's going to talk to us about what they're doing to underpin the delivery of information, data and services for citizens, focusing on data strategy and engagement, of course, with the citizens that you serve. Jonathan, this is a fantastic topic. We are so grateful to you
No
for
problem.
giving up some time to come along this afternoon and share with the audience what is taking place in Scotland from a digital perspective. I can tell you there's plenty of people on the call now who actually they're not necessarily directly interested in Scotland, but they are mightily interested in what the Scottish Government is doing in terms of response to the digital imperative. So if you're all ready to go, I think it'd be lovely for you to crack on, and then perhaps we might have a little bit of enhanced time for Q&A at the end of your presentation.
Yep, that would be absolutely fine with me. So thanks very much, and I really appreciate the invitation to come and speak today, and I hope the rest of the conference is great. Can I just check these slides have come through okay, John? I'm just trying to put it into...
Yeah, they are. You're not on slideshow at the moment.
Perfect.
You're on
I've got it a second time there.
There you go. That's perfect now. Thank you.
Okay, so thanks very much. Yeah, just a brief presentation to give to you this afternoon, and I hope you're all well. So I'm Jonathan Cameron, as John said, the Director of Digital Health and Care in Scottish Government, and want to share very much our thinking on our strategy that we have in Scotland, our data strategy in particular that we have out for public consultation right now, but also just to highlight some of the key programs and some of the key areas of work that we're very interested in taking forward across what is such an important area. So without any further ado, I will move through this. And so our strategy was actually refreshed on the back of our COVID response and the very rapid change that we saw over the past sort of 2.5 years now. So I have to confess, I actually just joined Scottish Government literally just before the start of the pandemic, and certainly from my perspective, it's been an incredible experience. But what we've tried to do in our strategy is then take that thinking, the pace of delivery that we have, and also overnight, the interest that citizens have in data and information, and how do we harness that for improving our overall health, care and well-being for all of our citizens. So we published a refresh of the strategy back in October, and we've been working towards supporting that and taking the major programs forward. So our vision that we have for our strategy is very much focused around this idea of right care, right place at the right time. And how do we move to a more proactive and personalised model for citizens? So as our vision states there, it's very focused on care and well-being. It's not just health. And making the best use of digital technologies and not just the delivery of services, but how do we actually design them with the citizen at the centre of those designs. So it's really important to us that we have the citizen on board, but also to very much emphasise the health and care approach that we are taking in Scotland. And some of you may have noticed just earlier this week, we actually launched the bill for the National Care Service in Scotland. And this will understandably have a significant impact on digital and what we do to try and bring health and care data, information and services together for everyone in Scotland. So our strategy has 3 key strategic aims. I'll just briefly talk through these just now, but the citizens absolutely being at the heart of everything that happens to them. So this idea of greater control, but also that ability to do 2-way communication far better with those that are caring for them or supporting their health. So how do we build on the infrastructure that we have to really open up new digital services, better information, but all with this idea of empowering citizens to better manage their health and well-being. Clear evidence that if you give people the right information at the right time, it leads to far better health outcomes. So the idea very much of that access and greater control is critical to us. Second aim, foundations, but not just the right thing, but also is it ethical? Is it safe? Is it secure? So there's very much our work on things like the CAI number in Scotland. We're looking to refresh and improve the unique identifier we have already rolled out across Scotland. But also this keyword in here around confidence. And for me, we talk a lot about skills and we talk a lot about what you can't do. But from my view, that I often think that if you give people the skills and the confidence to use technology, they will take it up and run with it. And again, we've seen a lot of that during the COVID response, where overnight people had to do things like Zoom conferences and use digital in a very different way. So we want to build on that momentum and keep that confidence going in the technology that we have. Obviously, cyber is a key element in there, and I think we'd acknowledge the efforts that we have to try and keep systems cyber secure as being really important as well. And our third aim is to recognise broader industry, researchers, innovators, those who would like to really come and work with us in the NHS and in our care sectors. So how do we get the data flowing to them in the right way? And how do we really support and bring through that innovation that we know that we need, but do so in a way that's supported? We see a lot of early tests of change and a lot of pilots, and often the joke is more pilots than any airport. But how do we take that and scale it up? And just in the last 2 days as well, we've launched our new accelerated innovation process, which we're hoping will give us that route to bringing through innovation far quicker to the front line and to those that really need to change how things are working. Briefly touching on these is actually our digital principles for all digital work in Scotland. I'm not going to go through all of them, but I think just to emphasise the importance that we place in Scotland on being collaborative. And then there's a much greater ethos behind working together and working in partnership, and the importance of being data driven and using data and information in the right way to change the decisions that are made, be that for individual patients or at an entire population health level. And using data in a far better way to drive that is really going to improve the outcomes and the overall benefits that we'll see for everyone. We've also done a lot of engagement with our citizens, as we've certainly progressed with developing the strategy and coming up our data strategy. Some of the key messages here are very much around digital being a choice. So we do recognise that health inequalities and digital inequalities exist. And again, coming back to that point of confidence, some of that is about people being confident to use digital. But we've also recognised that the right tool has to be used at the right time. So particularly within a GP practice, sometimes the phone is the right answer. That's the quickest, safest, best way to speak to a patient. So what we're saying very much to our primary care colleagues in particular is use the right digital tool at the right time. So as video consultation is the right answer, use it, but it's not going to be the default. It's not going to be you must do. It's always going to be about what's right for the right patient at the right time. And speaking of doing right, it's important we do get this right, and we often only have one chance to put the right foundation in place and the right system in place. The very last point, very key from our citizens as well and our patients, is about just that frustration of having to repeat information multiple times. We're very much going from that tell it once, share it many times approach, and really trying to build our systems and our processes so that that principle is there throughout the patient journey. And that's going to take some time to get there, but I think it's one of these fundamental principles that we think will make a big difference. So we've actually launched our data strategy for our public consultation at the end of May, and what we have here is just our initial vision for what we think our data strategy should do. So very much about driving the delivery of health and care in Scotland, empowering the public, which I've mentioned earlier, and that need for innovation, dare I say AI, but also the automation of data processes, machine learning, natural language processing, all have a role in there. So what we're trying to do is to, for the first time, set out really clearly in Scotland, what are we doing with data? How are we going to be the best benefit and use of it? How do we keep bringing patients with us so that patients trust what we are doing with data? And trust is actually just right at the heart of everything that we're doing across not just data, but actually digital in general. So it's really important you maintain that trust in order to improve all the services that are around it. And our proposed themes and what you'll see coming out over the strategy is again, not any great surprises, I suppose, but a big emphasis on an ethical-led approach. And again, one of our big successes in the COVID response was we took a very ethical-led approach to the Protect Scotland app, which is our contact tracing app. And we've built on that to say that's a good model for future programs. Big emphasis on information governance, but again, that real emphasis on the opportunity that exists from industry, from innovation to really bring that through as quickly as possible. So skills are key part of that, and opening up data access. And we would acknowledge there's still a lot of frustration in the system about who can or can't see data, and we need to get overcoming those barriers if we're going to really make the changes we need to do. So as I said, it has been launched back in May, and we've got the consultation open until the 12th of August. Would really welcome views from any members from IHSCM, collectively as a response, but individual response is absolutely fine as well. I've put a link in here. Links also at the end of the slides, and I'll share a copy of the slides with Jade, so these can be circulated, and we'll get that link widely shared. But really keen to get views. And just to stress, you don't need to answer all the questions. We've actually structured this so that it's easier to answer as a citizen or a patient. And there's a different section for industry or for research or for other areas. So there's, please cherry pick the best questions that best suit yourself. Would really welcome that. Thanks. To support the strategy, we want to be much clearer about what we're delivering when. I would acknowledge we're slightly later than we wanted to be in this process. We've been doing a lot of work in the background about how to make this easily understood. But we want to set out what are we building, what are the measures, what are the outcomes, and what are the milestones behind all the big programs that we're doing. Part of that is to actually support our supplier base to understand when's the next big system coming up for procurement, or what direction are we taking things for supporting digital transformation. So there's a big focus in this on primary care and diagnostics in particular, but it really encompasses all areas of digital health and care. So encourage you to look out for this when it comes out, and we're hoping certainly within the next month or so this will be available for wider consumption. Looking to confirm moves to cloud, future interoperability, but all hinges on getting to cloud in some cases as fast as we can, because it really opens up data sharing and data access and the improvements that we need to bring. We'd also just want to acknowledge the importance of net zero and climate in here as well. And digital can be a real driver for improving our response to climate change. And I've got one great example coming up in just a minute of the impact we've had with our NHS Near Me programme. We also have a programme for government, and I'm going to actually touch on all three of these big programmes that we're working on. We are going to work on our equivalent of the NHS app in Scotland, but do so in a way that really is service-led and citizen-led. We're doing some work in digital prescribing, and NHS Near Me I'll touch on in a minute as well. So digital prescribing, busy slide. I suppose the key thing we're trying to just drive in here is the importance of getting electronic signatures right for GP practices in particular, but for the sector as a whole. So we're starting a program, in fact, the program's well underway now, but really focusing on that immediate pressure of how do we start digitizing this so that it becomes easier to send a prescription to a patient on a mobile phone, or just to take the sheer drudgery out of that process. So really using that as a way of automating and improving. But we actually think there's wider benefits for things like payments and fraud, etc., where we can build in greater verification at the point of prescription. It's a really interesting program, and there'll be much more to come on that in both our delivery plan and future updates to come. Touched on Near Me. So this is our example of, just one of many examples we're starting to build around our impact on climate change. But over the last 2 years, 1.5 million patient consultations have been done. And we've estimated it's coming close to 50 million miles have been saved for patients not having to visit a hospital, not having to go to GP practice or, another site. And it particularly has a big impact in our remote and rural areas in Scotland. Some of the distances for patients in the Highlands are, staggering. It's not unheard of 500, 600 mile round trips for a hospital consultant. We can do it via video, and we've had great success in doing so. We're also building on this in terms of things like automatic consultations, and we've had a lot of success recently on group consultations. So again, during COVID, one of the big barriers was bringing people together. So we've tried to use Near Me to look at mental health and diabetes in particular as saying, right, let's try and build this digitally until we are able to get back together face to face. But it's been the case that even allowing face to face now, people are still happy with the digital approach and the difference that's making to them, and the reduction in hassle and travel of trying to get somewhere all at the same time. So we're looking to expand it further, and we're taking it well into the areas like social security, social care, a number of care homes already using Near Me as well. And there's lots of other opportunities for this video-led approach to make a big difference. I'm not going to go through all of these, but just to share that we've launched our Connect Me program on the back of Near Me, just to recognise again through COVID, a number of different specialties and areas that are really benefiting from new digital technology, particularly in areas like wearables and IoT. So particular success around our COPD program in terms of keeping patients at home and keeping them well, monitoring improvements, blood pressure as well. There's been considerable improvements actually in patient outcomes by being able to do much more regular monitoring of blood pressure. Lots of interest in improving our GP communication, how you make that a two-way conversation. We want to get away from the frustration of patients having to phone at 8 AM to try and get an appointment. How do we better fit with what patients want to do in the long term? So a number of examples here where we've had, varying success in making sure that patients are better monitored, not having to come to hospital, and are better connected to those who can help their care. Just want to touch briefly to say we're very committed now to moving to SNOMED CT, and really looking towards actually England and the other 4 nations to help us with that, and to learn from that. My big driver behind this is to say we need to improve the quality of the data we have, and to support future use of data like AI. So it was just a signal as another foundation. We're looking at clinical safety, we're looking at clinical informatics, and we're really using the SNOMED program as a way of driving that forward. The other biggie I wanted to touch on was our digital front door program, and very much the message being it's not just an app, and it's a real opportunity to make significant change to how we do services for citizens in Scotland. There's a lot of disparate, different information available. A lot of data is really kind of all over the place with limited or no control, and a real difference depending on where you live, the postcode lottery of what you can or can't do digitally. So what we're trying to do is put the national infrastructure in place to give it a consistent experience for patients, one that doesn't matter where you live in Scotland, the data will come with you, but also just that real drive to improve information and what services are available, and to get to much better place for appointment booking, prescriptions, and and another kind of very centralized transactions. So we really want to see this shift away from what was a very difficult place to navigate for citizens, and into something that's much easier, much more supported, much more personalized as well. Again, not going to go through this in detail, but just to pick out, on our citizen journey, we recognize there's not going to be a single place or a single point of call. Some people will be websites, some people will be app, opportunity for chatbots, but lots of other different touch points, and also recognizing the importance of people that act for other people on behalf. But that end point of the appropriate information being shared appropriately to make the biggest difference, and not to have to repeat it several times. And how it looks, this is our kind of initial first take, but we think it breaks down to some very clear sort of services, and trying to signal to citizens, how easy it will be to either view your information or register with an appointment, or to tell someone how they're doing. So we really want to try and get much better at patient-reported outcomes, and to get that two-way communication going with citizens, so that they can see their data over time, and they maybe start to recognize that, yep, they're not feeling so well, what might be causing that. We're also trying to really support getting people to the right place. A&E, absolutely overwhelmed at the moment. GP practices, they're doing more appointments than ever before in Scotland, and I can't thank enough colleagues who work in both those areas for the efforts that have been shown. So we have to get better at signposting citizens to the right places, be that pharmacy, minor injury units, self-care, giving them the confidence to say, no, you're okay, maybe do this, this and this, and maybe come back in a couple of days if something hasn't changed. So lots of different ways we can do things. Better access to video information, for example, could make a huge difference to how people will view their own data and what they do with it. And just the last area I wanted to touch on very briefly, and certainly interested in views on this as well, is around workforce and the importance of developing skills for managers, for all of us that work in the NHS and care sectors. And we're very much pushing forward now on not just the needs for the wider workforce, but recognising there's a need for specialist skills to be developed. Again, clinical informatics and clinical coding being a particular area of interest. Not a huge number of people that are trained in that, and we need to recognise the importance of that to build upon that. And building skills for the future. So I have mentioned AI, which I'm sure comes up in a lot of discussions, but there are other challenges coming down the line of, in certain areas we're not going to be able to recruit the same people that we've had before. So how do we digitally change the workforce to do things in a different way? And recognising also the importance of leadership and having our leaders confident in talking about digital and thinking digital first in their approaches and the service changes that are required. So thanks once again, John, for the opportunity to come and speak. That's the link to the consultation there, and also the link to our main website in digital health and care. And yeah, looking forward to some time for questions and comments on that. And so I'll pass back to yourself. Thanks very much.
Jonathan, thank you. That was absolutely exemplary. I enjoyed it, and you can be certain that we will absolutely respond to the strategy on behalf of the Institute of Health and Social Care Management. I know our members will be keen to do that. We've got somebody who's not on mute at the moment, I think, with a barking dog in the background. If you can just silence the... Oh, it's Jonathan.
Oh, that's mine. Sorry.
Let's leave.
Wrong time for the postman to arrive.
I'm going to go first. Well, we've got some fantastic questions in there. I'm just interested in you said it right at the beginning, one of your visions is citizens have access to and greater control over their data. And I'm just interested, this is a topic that's gone here and there in health and social care, certainly in healthcare in England for the last 10, 15 years, about how people will enable their data to be seen by care and health professionals. And I just wonder, do you currently have a methodology for delivering that, or is that part of the consultation activity?
So no, but that's part of the consultation activity, but also trying to understand what's out there. We've seen a significant shift in technology that would really help us with that. So I think that's why we're placing a lot of emphasis on cloud. If we can get more of the data into cloud, put the right technical, API infrastructure around that, it then becomes easier. I think the other thing to stress is we're taking our time to build it from the citizen's point of view. So we have the Scottish approach to service design, which is quite well embedded now in a number of things that we do. So what we're trying to do is set out those user journeys and from the user perspective of how best to do that. I think we're also minded of just opening up the access isn't enough on its own. And actually the harder challenge is how do you best support citizens and people to understand the data that's been given to them, and where do they go to for support, even something simple as getting it corrected. We've learned a lot from that actually from the vaccination program, and particularly the need to provide COVID certificates. And that's really opened up this idea of, we're going to have to get better at that whole process of data quality and data improvement. But even again, coming back to the coding point of, yeah, you could put one code in and clinically that makes sense, but to a patient it won't make sense at all. So there's that translation layer is really important as well. The control one's an interesting one, and we are still grappling with what does that mean, but we think initially it will be like, here's the information we're holding, here's who's seen your information recently, and here's where to go to for support, and then over time we can get probably more sophisticated responses to that. So no, we're setting that out. We're very much on a journey on that, and again, learning very much from experience, not just from the four nations, but actually globally with a lot of work recently with Denmark in particular. So we're very much learning from what's been done before and hoping then to build the next generation of that, or the best of breed of that.
I must say, I'm so pleased to hear that you're looking outside of the UK for inspiration as well. I think that's a really smart move. All right, look, if we don't mind, we've got a few questions here. I'm going to start with Yvonne's. Great question from Yvonne. She says, a lot of health and social care services use different data recording software. Is there any work looking at bringing in one system for all, or ensuring these systems can work with each other? For example, GP or hospital notes recorded in one system, care home records recorded in another, so often there has to be a repeat of the story. You did refer to this, to be fair, in one of your slides, but can you perhaps give Yvonne and the rest of us some kind of an inkling in terms of how you're reading the rooms in this regard?
So I think it's on two fronts, one technical and one almost from a data standards perspective. So on the data standards side, that's very much going to come out in the data strategy as well. We've recently established a data board to help us drive through actually mandating this is the right way to record things, or this is the standard we expect. We're slightly lucky on the technical side in Scotland that we don't actually have the same plethora of systems, particularly from an English perspective. Every health board in Scotland, bar one, is using Track, the Intersystems Track Care system. We only have 2 GP providers, and what we've actually done is, through our recent GPIT program, is saying, no, there will be standardized ways that you record information. Now, it might look a bit different from the user interface, but the same coding system will be used behind it. And that also is underpinned by our drive to use SNOMED across Scotland.
Can I just ask, because it's really important for our members, because we have social care people who we represent as well. And certainly in England, the anxiety is being driven by what feels to a lot of the social care people like a kind of an exclusion or not being taken seriously. All the emphasis is on acute and primary care for digital interoperability and so on. Where's the solution to bring social care under that umbrella as well, so that you can genuinely deliver an integrated system?
So we've had a long history now, but again, absolutely accelerated under COVID, of making sure that social care are absolutely front and center, at the very least equal partners in our discussions. So that data board I referred to, it's almost a 50-50 split of social care and health, with they're supporting and doing the work. Social care is going to be more challenging because, and again, I recognise this in Scotland, there's a greater difference in systems. And part of the reason I think we start from health is that there's a kind of greater history within health, certainly in Scotland, of standardization and working to the same coding system, or standard XML messaging even. So XML messaging in Scotland for core clinical systems has been around 25 years. Through systems like SkyStore and the Emergency Care Summary that was rolled out, way back in 2004. So care homes, we know we need to do more work with. We, as I said, just a couple of days ago, launched the National Care Service bill in Scotland, and core from a digital perspective is this idea of an integrated care and health record, and actually emphasising it that way around. We're starting with care and then how it will integrate with health. We want to very much make sure that social care workers and those working in care homes have the information they need first, and then we'll look to, right, what other benefit could that bring for someone working in primary care or community care or even acute. So again, a real journey to be done on that. It's recognizing as well health of a very different approach to treating the individual as an individual, whereas of course social care is much more about cases and family relationships. And
yeah, I mean, the anxiety is about just the data, and just to try to make sure we have consistency of data across the system, as it were. And that's the bit that there was anxiety, certainly in England. It continues to be an anxiety about.
I'm hopeful, looking towards innovation, that actually that might not matter as much. And the reason I'm thinking that is we're starting to get towards real sophistication on natural language processing and just some of the tools that are there to extract particularly free text data.
Yeah.
So what we're trying to, or certainly what my feeling is, just record it in a way that makes sense to you, and hopefully we can build the tools that then would allow that to be coded in some way, or shared and understood in a way. I think we definitely need to do more work on supporting frontline staff in recording data, but really from the view of we've got to stop manually recording data. It's got to be automated in better ways, and there's a number of tools we could use that would take the pressure off frontline staff from logged into a computer typing something up.
And even things like writing, we do have an obsession with writing, and we had a great session on EDI yesterday for our EDI, Equality, Diversity and Inclusivity Special Interest Group, and they're saying we've got to get away from that. There's so many other ways of recording information about people that is respectful to their abilities and such like. All right, look, we're going to have to push along because we've got some other questions here. June, fabulous June Hall's with us today. Lovely to see June. She says, you've kind of answered this. You've said June says, in the same vein, how far has Scotland progressed in integrating primary and secondary care patient data, given that the majority of primary and secondary care systems are from the same suppliers? Removing to cloud, how are you overcoming security concerns from clinical users? Do you want to address that one?
I'll address the second one first. Yeah. We're not seeing anywhere near the same level of concern as there was 3 years ago. And if anything, if you can show the benefit to the front line of why you're making that change of, in many cases, information is available far faster, and the opportunity that brings, certainly I've seen a marked decrease in concerns about cloud security and what happens with it, to the point that we kind of say, don't worry about where the data's held, don't worry about worry about what you're going to do with the data and how we can support you to use that data better or provide more or, work better with colleagues. To the point that, we're actually got a major focus now on how are we going to bring health and care together through tools like Office 365. So a big program now underway to look at, even at a very simple level, how do we get overcoming those barriers to share calendars, share documents, know who's in, know what services are available. So it's almost a kind of back to basics bit and saying, right, that can be supported by cloud. So yeah, I absolutely acknowledge the concerns there, but it's drastically reduced as people understand, this is actually what's happening and just the benefit overall it comes. We've had a lot of success to date in using Clinical Portal in Scotland, and again, that Once for Scotland approach that we have, and in some cases we've standardised on having the Orion portal in many health boards in Scotland, which has helped bring together primary and secondary care data. And we're now going to take that learning into, right, how do we bring primary, secondary, care home, social care, and other data sources in the future together. The critical element is interoperability and agreeing the standards around that. But as the understanding of data systems improves, the maturity of this whole area improves, it stops being quite so much a concern of they're different suppliers, as long as you've got the agreement on the standards, which is so the drive to standards is what's going to really support further integration. And that ability to do two-way. So often what we're seeing is it's view only, or yes, you've got access to it, but how do you update it? How do you perhaps send a message back to say, you really need to check on this patient in 3 days and make sure you're confident that's been picked up. It's about building that service around the citizen to say, yes, I've supported this person on this day, but I need to pass it to, someone else in the community and be confident that that's happening and being addressed.
All right, thank you, Jonathan. Very quickly, I'm going to give you Judith's question. Judith says, this is a great question, Judith. What is a group consultation? How does this work for mental health when the development of a trusted and trusting relationship is so crucial? I guess what Judith's question does, it exposes, we've got so many different groups that we've got to include in your consultation strategy. But over to you. How would you respond?
So what I was referring to is certainly maybe diabetes is a slightly easier example, but there was often face-to-face drop-in sessions, for example, for diabetes, where people would come together to try and support each other. And during COVID, although there was Zoom and a couple of others, it wasn't done in a very controlled way or in a way where people could be supported. So we've used Near Me as a way of securely bringing people together in what used to be face-to-face consultations. So mental health is, and I should stress I'm not a clinician, but my understanding is it's very much about getting that peer-to-peer support for certain groups together, and it's being done in a way that allows them to think it's part of their NHS or part of their care. And there's other things that we're doing in the back end from all of these, you and me consultations about, that often maybe helps the lead clinician, come back to understand what was discussed in a session or whatever. So, yeah, I mean, often one-to-one is still required. Face-to-face is still the right thing to do at the right time. And again, coming back to this point of digital being a choice, but it's really helped keep people in touch and keep people engaged in certain groups in certain areas. But also for us, again, acknowledging for Scotland, it's just bringing people together, remote and rural, who often don't have the choice to actually potentially join a session that maybe is about supporting your depression or supporting postnatal depression. There's a number of different use cases. So it's really just that opportunity to say, look, go and use it, see if it helps, see if it works, and see if that helps build trust or build support with other people who may be doing the same thing as you. But it's not right in every case. And again, it's just that element of choice, an element of trying to support people who, again, might not be able to access that service face to face.
All right, perfect. Jonathan, thank you. And thank you for the question as well, Judith. All right, look, we're out of time there. Could I just encourage members who are on the call today, if you've got comments, opinions, insights, analysis that you'd like to provide to Jonathan's consultation document, you can either go direct to the consultation document, and we will put the link in the chat, or contact us. We'll do it on your behalf. We're very keen to collect that information from our Scottish members so that we can share that with Jonathan and the rest of the Scottish Government and make sure that we present your views properly and clearly. But Jonathan, thank you so much.
Thank you very much.
Nice
to see you all.
And we
enjoy the rest of the conference.
And we would love to be involved going forward in helping.
Please do.
Yeah,
consultations the first start of many opportunities by joining in that. So yeah, thanks once again. Take care.
Magnificent. Thank you very much, Jonathan. Bye-bye. Okay, folks. Well, I thought that was good. I enjoyed that. Enjoyed listening to him. I think it's always dangerous and difficult for a government spokesperson, expert, director to come on and kind of present a government position, because it's always open to all sorts of different views. But the fact that they're doing a consultation and they seem genuine about wanting to attract information and analysis and insight, I do think is reassuring. I suppose my observation would be, for heaven's sakes, hurry up with it. The last thing we need is another consultation that lasts 3 years or something, because by then, we all know that everything will have changed. So there we go. That's my little tuppence worth.